Welcome, everyone, to our session, Cash Aid, Views from the Front Lines of the Pandemic. My name is Hala Ahmed. I'm the Vice President for Policy Communications at the Jane Family Institute, co-host of this event alongside Urban Institute and Aspen Institute Financial Security Program. Before I pass to our panel host, Mary Bogle of the Urban Institute, a couple of things. To those joining virtually, this panel is taking place as part of a series of meetings today hosted by the Jane Family Institute and Aspen Institute Financial Security Program and Urban Institute for the first time in over a year in person in a fully vaccinated event here in DC at a crucial time for informed discussion of benefits policy amid the debate around the American Families Plan and other pandemic recovery policies, long-term economic recovery policies. So our event today hosted two previous discussions of federal safety net policy following Chatham House rule to ensure staffers and experts could engage deeply with debates and evidence on the expanded safety net. This panel is a hybrid. We have an in-person and a virtual audience. As you leave questions in the chat or through the Q&A function at the bottom of the screen, we will bring your questions into the room with us, so feel welcome to introduce yourself to other participants in the chat and let us know where you're joining from. If you've participated in the previous two discussions here in the room or over Zoom, please mind Chatham House guidelines around the last two talks as you relay your questions in this session. And let's get started. Mary, over to you.
Hi, everyone. Thanks, Hala. The Urban Institute, and my microphone was not on. Now it's on too much. All right, one thing I'm going to say to the folks tuning in, just tuning in on Zoom, if you've been an adherent of events at Urban, and I know you're out there, we've got quite a fan following, this is different. You're seeing a live panel today. Usually you get the Brady Bunch boxes. So if that's throwing you off, imagine how we feel. So and that is my way of asking for your forbearance for any glitches, like my microphone not being on, not being quite used to not being able to put my notes up on a little music stand so nobody knows I'm reading notes. So if you see glitches today, just wave them off. As Hala mentioned, there were two panels previous to this one, and they were quite, I would say, wonky in a really fascinating way about the macroeconomic effects of cash aid during the pandemic. Cash aid like the unemployment insurance, the expanded unemployment insurance, and the economic impact payments. That's what I was struggling to remember. And one of the themes that ran through our very wonky discussions, there was also another panel on the child tax credit and other issues in the unemployment insurance systems and tax systems. But one of the themes that really ran through those very wonky panels, fascinating but wonky panels, was how these cash aid pieces that came out during the height of the pandemic to help people were actually quite inequitably distributed. And you're going to hear a lot from this panel today. We're the user-friendly panel to help you learn about what it was like, and we have different voices on the panel today that I'm about to introduce to you, for a number of folks who could not get at that cash aid that was distributed during the pandemic or had limited access to that. So that is the purpose of today's panel. So if you're just tuning in, you will hear that. My research agenda, just a little bit to know about me, is that usually at the intersection of household well-being, social networks, positive social networks, and the equitable development of neighborhoods. I'm very interested in cash as a tool for leveraging all three of those things. I really see it not just a policy tool, how can we give cash aid out, but as a tool families can use and individuals can use to make their own choices as they traverse their lives, work with their friends and families to advance themselves economically, and leverage every good thing that their neighborhood should have to offer to them. I'm excited to bring this discussion to you today because even as the painful as the pandemic has been for everyone, it has also delivered some powerful lessons for safety net reform. Urban Institute research has shown that the federal cash aid distributed during the pandemic worked well in many ways to reduce hardship for many people and families. On the downside, and it's a significant downside, those reductions in hardship were inequitably distributed across various subpopulations, especially amongst bypassing many people of color, who were also the hardest hit by the pandemic's health and economic consequences, adding insult to injury. That cash aid also excluded many, many people who needed help as much as anyone else. And you'll hear from the panel today about that as well. So today's panel, again, are folks that we've gathered from who we call sitting at the front lines of the pandemic. And they're going to help us understand the lessons learned from pandemic cash aid about how we might reform our current gap-ridden U.S. safety net. And by safety net, I mean both social insurance and public assistance benefit, as well as some tax system benefits like the tax credits, child tax credit, earned income tax credit. But how to take that gap-ridden web of the safety net and turn it into a springboard out of poverty that it should be, because it does not function that way at present. On our panel is George Jones, Chief Executive Officer of Bread for the City, a remarkable DC-based nonprofit that provides food, clothing, medical, legal, and social services to DC residents living on low incomes. George will represent our practitioner perspective today. And I would add that I've worked with George quite a bit over the course getting some pandemic relief to folks and over the course of the pandemic. And one of the things here at a time when we're all sort of looking harder at our organizations and our racial equity lenses is that George's organization has a racial equity lens that I think beats most. We also have Laura Zeilinger with us today. Laura is the director of the DC Department of Human Services, a 1,200-person agency that is charged with empowering every district resident to reach their full potential by providing meaningful connections to work opportunities, economic assistance, and supportive services. And last but not least, we have Shamila Ruiz, who is the director of communications at One Fair Wage, a national coalition campaign and nonprofit organization seeking to lift millions of tipped and sub-minimum wage workers nationally out of poverty by advocating for raising wages and improving working conditions across the country. Shamila has some important data to offer on this constituency, as well as on her own lived experience as someone who spent 10 years of her life in the service sector herself. Now I'm going to give each panelist 5 minutes to tell you a bit about themselves and the vantage point they bring from the front line of the pandemics to today's panel. Let me start in reverse alphabetical order and ask Laura Zeilinger to introduce herself.
Hello, everyone. It's like the mute button in person, right? You have to remember to turn your microphone on. My name is Laura Zeilinger, and I'm the director, as Mary said, of the Department of Human Services for Mayor Bowser in Washington, D.C., and really pleased to be with you today. There's a lot that we can say about what it's been like to be on the front lines of the pandemic. And as a District of Columbia government, which serves both municipal, county, and state functions, we've been very much on the state lines, or on the front lines, I would say, as of our emergency response. First, in terms of making sure that that emergency relief was there for people, that we were able to provide access to safe shelter for people who are staying in congregate settings, and that people could access food and other necessities during the course of the pandemic. In addition to that, we need to be able to shift our services to make them accessible to district residents. District of Columbia is actually more populous than about 4 other states in our nation, although we don't have representation in Congress yet. We hope to one day. But nonetheless, we serve a lot of people, and we have a lot of residents who both pay taxes and also rely on help from the Department of Human Services. We serve more than 300,000 residents through the range of programs and services that we offer at DHS. So when we look at access to income support programs, which we all understand in this room, it's part of why I think what unifies us here together is the necessity of that, of being able to care for one's family. That is very much what we do. Through the course of the pandemic, that meant that we talked a little bit about preparedness this morning and what it means to have an infrastructure that is prepared to serve residents. So, in that, it meant being able to, as we've invested in updating our systems that administer public benefits to residents in the District of Columbia, we needed to go further, faster, and be able to make sure that people are able to access those remotely by launching mobile application and online benefits portal. Also, making sure that people are able to access other services remotely, making sure we were able to put technology in people's hands so that they could access the services and supports that they needed, as well as to be able to provide the range of services and interventions. And we learned a lot in doing so, some things that we think made us stronger, and some things that we know we need to continue to invest in to be able to serve. I know that we'll have a robust discussion today, so that's just my brief introduction, but it certainly we will go far beyond just the income support programs to the dignity of housing and how that plays in, and the intersection between health and well-being and the programs that serve people who have very low incomes.
Thanks, Laura. Next, we'll have Shamila Ruiz of One Fair Wage.
Thank you so much, Mary, and thanks to everybody for coming to hear this panel. So again, my name is Shamila Ruiz. I'm the Director of Communications at One Fair Wage. We have a kind of a unique perspective to this conversation, both as a national policy organization whose goal is to eliminate sub-minimum wages for the nation's tipped workers, which include largely the service sector, restaurant workers, but also airport attendants, nail salon workers, car wash workers, all who rely on a sub-minimum wage in the United States. So first, as a campaign and policy organization, but also second, as a emergency relief fund. We created an emergency relief fund at the onset of the pandemic, which was able to raise over $26 million. We had over 300,000 workers apply, and we were able to disperse these funds that we fundraise both through institutional donations and individual donations to these workers. But most of all, we were able to mobilize them to advocate for fair wages and to lift themselves out of the situation that they found themselves in, the precariousness of the service sector, which I'll talk a lot about in a little bit. We were able to mobilize a lot of this list to vote in the last election. And we've been able to mobilize them to recruit their peers and talk to them and share their stories about what it's like living in the service industry. So we were able to bring a voice through this emergency fund, get direct payment, but also beyond that, be able to mobilize these workers to action. So really quickly, prior to the pandemic, the restaurant industry was the largest and fastest growing sector of economy. We had nearly 13 million workers. As a result of the pandemic, more than 6 million workers found themselves out of work. And sadly, it's historically been the largest, while it's the largest and fastest growing sector, it's the absolute lowest paying employer. Every year, the Department of Labor puts out a lowest jobs rating, and every year, 7 of those 10 jobs are in the restaurant sector. This is largely due to the money, power, and influence of the National Restaurant Association, who has, for decades after emancipation, sought to hire Black people and women, not pay them anything at all, and let them live off tips, which has drove down the wage down to $0. And then that became law in 1938 as part of the New Deal. So we've gone from a $0 minimum wage then to $2.13 at the federal level over the last 150 years. Right now, the push to eliminate the separate subminimum wage for tipped workers is actually part of the Raise the Wage Act, which is moving through Congress, which would raise wages for tipped workers, youth workers, and workers with disabilities. So we're hopeful there. And we've also introduced legislation in 16 states, including the District of Columbia, 16 localities, including the District of Columbia. So as I mentioned, we were able to gather a lot of data through our emergency fund applicants and found that during the pandemic, over 63% of tipped workers were not able to get unemployment benefits because they were simply told their wages were too low to qualify for benefits in most states. We talked to workers who had worked in the industry for 30, 40 years, working 2 to 3 jobs to piece together a living and weren't able to qualify simply because of the sub-minimum wage for tipped workers. We'll talk a lot about the challenges that they face, but really they had to go back to work before they felt safe. They were asked to enforce these health protocols going back to work and really put in a precarious situation. All in all, tips were down 50 to 70%, 75%. So we are really happy to be a part of this conversation and to bring up the voices of tipped workers and the challenges that they've experienced prior to the pandemic and now.
Great. Thanks, Shamila. Now we'll hear from George Jones of Bread for the City.
I'm going to say my name one more time. George Jones.
Yeah, right.
From Bread for the City. I've been at Bread for 25 years. We are probably a mid-sized nonprofit here in Washington, D.C. that provides, as Mary said, food, clothing, medical, legal, and social services. I cannot say that alliteration of things because I've been saying it for 25 years. But we also provide organizing and advocacy efforts so we try to fight poverty in two ways. We try to provide direct services to community members who live on low incomes, and we've always tried to help reform systems that we think help perpetuate poverty. It really sort of the root causes of a lot of the poverty that we've been trying to interrupt for the last 47 years. That's how old Bread for the City is. And then of course, when the pandemic hit, we were an organization that for most months we were serving about 5,000 households, coming to our two community centers, one in Southeast DC, one in Northwest DC. We still own and operate those community centers. In fact, we just built a new 27,000 square foot facility that has been named the Michelle Obama Southeast Center of Bread for the City. And so we're really proud of that. That new center is there, but the unfortunate part is, for all intents and purposes, we have not been able to open that center. Almost all of our efforts have been remote. And so instead of having 5,000 households show up to pick up groceries from our food pantries, we've had weeks where we've served 5,000 a month. We've had weeks during the pandemic where we've served 10,000 people in one single week. So a huge spike. And in fact, we went from spending about $1 million a year in food stuff that we distribute to families throughout the 12 months to this year. We haven't seen the June fiscal statements yet, financial statements, but I think they're going to be close to $3 million that we spent just on food distribution alone. So that was a really important lift for us. But of course, I've been invited here, and when we have medical services that have really been central to folks who needed to get COVID testing and now the vaccine, and we've been seeing most of our patients. We have about 3,000 unique medical patients that we see remotely. We've seen remotely throughout the pandemic. Our legal services serves about 2,000 unique people in housing and benefits and public benefits and in domestic violence and other family law practices and immigrant services. So, our sort of model was, our theory of change was to create these one-stop shops that help address all of these holistic array of needs and services people need to access. And at the same time, trying to figure out how to reform systems, which is why it was kind of natural, I think, for Bread for the City to be tapped for two programs that we'll talk about today that are sort of cash transfers or cash initiatives that play themselves out today. I think primarily Mary invited me to talk about this Excluded Workers Fund that was created. And we have had two iterations of that. The initial fund was targeted for people who were identified as undocumented. So I think we served about 1,000 or so people in that. No, it's more like, I don't have the number right, but we served thousands of people in that space, provided $1,000 through a fund that was basically administered by the Events DC, which is a kind of quasi-government group that took the dollars and then gave them to a community foundation here in DC. And then they distributed to about 5 nonprofits, including Bread for the City, where we distributed them in gift cards. So they were gift cards of about $1,000, not about, exactly $1,000 to each family that we served. And then there's another iteration that just started. The first one went from June to October, and now we've just started with a second one where there's $9 million that the government has actually put in its budget for families and individuals. The interesting thing about the new one is that it really has a variety of sort of folks who identify in various ways. In fact, Yamila sort of just described the population, those folks from restaurants and some of the other sub-minimum wage sort of jobs that are in the district. And so we're looking forward to giving $1,000 to those families. We've done probably a few thousand already. But I think that they were looking to sort of ultimately distribute $9 million to those folks. And, it was really important. I think the nonprofit sector, just like I heard somebody mention in the previous panel, came together was we really realized that early on, it was obvious that the pandemic was going to hurt people of color disproportionately and people with low wages and people who have lived in poverty all their lives. And that was true. And so Mary mentioned this earlier, it was really important for us to not allow this to play out completely in a way that was predictable, which is people of color disproportionately affected economically or socially by the pandemic. So I'm looking forward to talking more about how we will. There's another project, by the way, called Thrive, where 4 nonprofits came together to actually create a kind of a purely private cash transfer. We raised about $4.2 million, served 500 families, gave each family $5,500. And there's a lot to talk about in terms of what we learned from that initiative. But I think the most important thing to say about that is that it really was a kind of economic boost. I have sort of anecdotal stories about what people did with that cash. And for the most part, in fact, I haven't heard about one person who went off to Vegas and spent that money. So don't worry about any of those things that people worry about. People pay for the rent. I think 70% of the time studies show when people get this influx, they tend to spend it on housing because housing is a crisis for people. Quality housing is a crisis for people living on low income. So looking forward to talking about how these initiatives went and hearing your questions ultimately.
Thanks, George. Yeah, and I think that the important thing to pick up, especially from Shamila and George's comments, is that they've just described to you a number of groups that really could not access federal cash aid in the economic impact payments and the unemployment insurance. They were excluded, and the groups they described to you are also it's an understatement to say majority or disproportionately people of color. They're vast majority people of color in these groups. So there you see the imbalances we see in how our safety net, even in an economic emergency, serves people differently in this country. And it's a big problem. And it's something that we absolutely, as we move out of the pandemic and look ahead, need to take the lessons of the pandemic. I'll let each panelist describe more about the barriers. I think there were also some interesting lessons learned that one might even characterize, if one can, as positive. And George, I'll throw this one to you. I'm the principal investigator for the evaluation of Thrive east of the river. It's pretty much, we think it's the largest lump sum cash transfer program ever created, actually at $5,500 in a lump to folks. It was targeted at people in Ward 8 in the District of Columbia, who again it's like 90% African American, 70% live below the poverty line. It's in terms of the children in poverty. And it's absolutely, those folks needed the cash most, and the $4 million that was raised were from local philanthropists. DC Cares was, as George said, a quasi-governmental effort. So again, not federal money, private or local government money. But George, one of the things we learned in Thrive and was very interesting to me when we started working with you on Thrive was there was, in the early days of launching Thrive, back in the hurly-burly days of March and April, one of the real concerns your staff, and you have a lot of lawyers on your staff, yes, which is a really huge asset. I learned a lot from your lawyers, public assistance lawyers, public benefit lawyers. And one of the big concerns early on was, boy, if we hand all this money to folks, they're going to lose things like Medicaid, because Medicaid has these cutoffs that don't allow you to keep your benefits if you make too much money. So again, we're capping people trying to get out of poverty. And one of the big dangers was, even if you could recertify for some programs and be on them the next month, imagine if you lost your Medicaid 1 month, had a major medical health emergency, and then we're stuck with those bills. And we had to work through in the early days of Thrive how we were going to deal with that. So George, tell me a little bit though, what did we actually find out about Medicaid in the pandemic that was positive, I would say?
Well, let me say I've been nonplussed for forever that we have this asset test. I think the maximum is $2,000 and you can save or whatever. Like nobody can get out of poverty. You're not going to get out of poverty by being able to save $2,000. So, one of the really important things we always knew is that our initiative was as much about public policy reform as it was about the cash itself. That we at $5,000, $5,500 isn't going to get somebody out of poverty. So we never had illusions that that was what was going to happen. We thought we would be helping people, certainly a kind of financial safety net during the pandemic. But we were really, you're right, our attorneys, our social workers too, really raised the flag early on. We started to talk about this initiative about giving out $5,500 to 500 families about their benefits, because virtually all of them were on some form of public benefits. And the number one concern was around Medicaid, particularly because we were in the midst of a health pandemic. And so it'd be the worst time you can imagine to lose your Medicaid coverage. Because as one of my staff put it, you give somebody $5,500, but next week they may have a $50,000 health bill. And you really will, that $5,500 will look minuscule. So we had to really spend some time really thinking about that. Fortunately, I mean, the short story of it is that fortunately a lot of moratoriums kicked in, and most of those programs had moratoriums around people having to report. It wasn't necessarily that the assets didn't count, it's that the reporting was restricted or limited, suspended maybe is a better word, during much of the pandemic. And so people still could make that choice, but people didn't have the pressure of worrying about whether if they reported the $5,500. So that was really great. But I think the thing that was, I think one of the things that Mary is alluding to is that, for me anyway, is the fact that a moratorium could be declared. I mean, people would have told me before the pandemic that you couldn't do any of the stuff that people did within a matter of months. So that was including my own organization. I mean, I got my staff to do things that they probably for a decade were claiming was too inefficient and too difficult to do. And everybody had to pivot literally on a dime to get these things done. And that was great to see. And it was great to see that the local government, I think DC government did as much as any state in the union in terms of really looking to how can we both, discontinue anything that would interrupt benefits for people. But also really figure out are there dollars that we can direct to folks who we know won't get benefit from some of the sort of federally funded cash programs. And so that was really important to us. And so we're really excited about the possibility of convincing the government that we can do some, what you might call waivers around some of these cash programs. Because the other thing we found was that a lot of these private funders, and most of the major foundations in DC, really, another thing, if I had asked them 2 years ago for cash for community members, they would have said, what? Are you kidding me? And yet, all of them were standing in line during the pandemic, gave $200,000, $2,500, $500,000 for this program so that we could give cash to people who they understood too were going to be really disproportionately affected from the pandemic. So.
Great. And we're going to get to in a second over to Laura, who's going to talk to us a little bit about this notion of how the government interfaces, creates waivers, the moratoriums we saw, how her agency shifted some services, et cetera. But first, another story from Thrive that was sort of fascinating to me, in addition to what Urban Institute research shows, is that some folks really, because they were able to combine pandemic federal cash they were eligible for and cash gifts like the $5,500 may have actually reduced their hardship. I mean, we're collecting data that shows some of that. And again, are we begrudging that in US culture? Maybe, but we shouldn't, because that gives people a platform to move from stability to mobility out of poverty. This is the thing we miss in our safety net, the way it is now. But one story from Thrive that really, I have to say, upset me was about a sub-minimum wage worker. We were looking for folks at one point who had started maybe new businesses to find out. You get a $5,500 windfall. The folks that we saw in the Thrive population, very innovative folks. We were hearing interesting stories. And I kept hearing a failure to launch story in some of the, it was, I want to start a new business, but I need to use this money to survive. I've got my ideas. I'm setting up an LLC, but I didn't quite get all the way online. So here are people who are very enterprising, want to move forward. And one of them, Shamila, was a woman who worked in hair care, the kind of person we would encounter every day. I just got about this much hair from COVID cut off. And I encountered a tipped worker this morning. I encountered a tipped worker at my parking lot when I came to this event. So tell us a little bit more about the barriers that the tipped workers encountered, Shamila, because we see them all the time in our lives.
Yeah. So thanks for bringing that up. So as I mentioned, of the workers that we surveyed, 63% of them said they couldn't get unemployment insurance because they were told their wages are so low. And now we're in this moment, a year and a half post-pandemic, where businesses are reopening. You're hearing a lot on the news about their failure to, or their inability to find workers who want to work because they're staying home collecting unemployment insurance. We're saying they never got that unemployment insurance to begin with. They haven't gotten a lot of these benefits, pandemic assistance and otherwise, because their wages were so low. They were working 2 or 3 jobs, and they didn't qualify for unemployment insurance, pandemic benefits, stimulus relief. And so of the workers that we surveyed, 53%, more than half, said that they're leaving the industry altogether or they have left the industry. 76% of it attribute it to low wages and tips as the primary reason for leaving. And 78% said that if they were paid $15 and full fair minimum wage, they would come back to work in the industry. That would be the incentive. So we've learned from the data that we've collected over the last year and a half that it really is about fair wages, paid sick leave, all these benefits that workers need in order to survive, because they can't survive on sub-minimum wages at a time where, the argument used to be like, well, tips are good, so, you can live off of that. Tips were down 50 to 75% throughout the pandemic, and they're still not back to pre-pandemic levels. So we hear all the time stories from workers and small business owners who say, I have no way to signal to workers, even if I'm a what we call high road. We have over 1,000 restaurants in our small business high road employer association who we provide training and technical assistance to be able to take the high road to sustainable business practices. And they say, we have no way to send a signal to our market wherever they are. They're all over the country. Unless federal policy change happens to bring these workers up to fair wages, we have no way to signal. And so workers aren't going to want to come back. Even if I advertise, they're not going to want to come back unless we signal. So that's been a big learning opportunity for us, is through the data that we collected from the fund, through conversations and interviews that we've done with small business owners and workers who weren't able to get pandemic unemployment and have either left the industry altogether, but are willing to come back if we raise wages and we expand unemployment.
Yep. Thank you. So, Laura, tell us about the view as an administrator of public benefits at the state and local level. You'll notice there's a theme today on our panel. This is a very DC-based panel. We're in the District of Columbia. I work with a lot of folks who I do place-based research in the District of Columbia, and we wanted to give you a case study. So take us to the view of a local government administrator on all this, Laura. What do you think is our way forward for safety? Like, what have we learned from the pandemic? What has your agency learned, and how might we think about these cash aid questions that we're raising here today?
So, in the federal policy in our country, we have an issue that we've alluded to, but I'm just going to name it, around scarcity. That when people are living in scarcity, it is impossible to expect that they have a real opportunity to exit poverty, to be able to achieve economic mobility, to grow their income, to access wealth. And we have baked into our individual income support programs barriers to that growth. And so when you talk to people who are trying to subside on a combination of TANF, SNAP, childcare subsidies, Medicaid, and about their journeys, and also who access housing supports, it is really heartbreaking. And so what we hear are stories of people who very much want to work. There is not one individual, I think, that I've met in our programs who says, I am just living so well on these programs that I actually don't need to work. Like, this is awesome. I am providing the life that I want for my children. I'm doing great. So work participation requirements and the whole culture of our public benefit programs that suggest that we must force you to do something so that you can be deserving of some amount of money to subside on are just backwards. But the thing that is, I think people may not fully appreciate also, is that as people begin to earn and grow their earnings through employment, that they lose eligibility for those programs at a rate that is much greater than their income grows. So when I sit on the Workforce Investment Council with a number of employer partners and labor, our labor funded programs and other government agencies, education agencies. And one of my first days 6 years ago with the District of Columbia, one of our employer partners said, you need to fix this thing. When I am hiring people, I'm training them, they are talented and superstars, and they say, as soon as I start to promote them, they quit, or they say, I'm sorry, I can work 19 hours, but not 20, because as soon as I work 20, I lose my housing, or I lose, and you can fill in the blank. Childcare is one of the really big ones. So these benefit cliffs that people encounter actually keep them. They're structural barriers that keep, and I'm just going to say it here in the District of Columbia, when you look at the complexion of our population, they keep Black and brown people from accessing wealth and achieving economic mobility. They just structurally, if you don't have someone who can help bridge you to take that next job and grow in your career, you have to make a choice about whether I'm going to be on the street or I'm going to increase my income. And that is wrong. It's just wrong. So one of the things I'm excited about, and a lot of the things that we've done in the district to address this, we've done with local funds. And this is, George talked about what they've done with philanthropic dollars. There are some things we've done in local funds to try to make this different for people. So we are piloting an initiative, or we've proposed to pilot. We'll see what happens in the final budget process, but I think there's a lot of excitement around this, a program called Career MAP standing for Mobility Action Plan, where we will support families with histories of homelessness who are receiving short to medium term help with their rent so that they will not encounter a benefit cliff at all. We will fill in with, it will augment the public benefit programs with dollars that will allow people, as they earn more, to both keep more and not lose the value of their housing subsidies, their childcare subsidies, and other public benefits, to demonstrate what is possible and support them to grow their careers. We'll do this in partnership with members of our employment programs in our sector strategies, so that people are accessing careers and jobs that pay a family wage in the district. And we will see what we learn when we stay with families over the long haul to confront these barriers. So we're very excited about what we'll learn. We think it can inform a national question. It is more complex than it should be, because we will have to figure out these things about how do we augment these programs without then we're basically forcing that we then have to fill in with greater amounts for a whole bunch of all of the interactions of how much people can accumulate in terms of cash and so forth. But here's what the bottom line is, here's what we know, is that even with when we pay people's rent, that they're making impossible choices, that they want to provide for their families, and they have to choose between growing their income or what they can do earning and not reporting their income, so that they can earn enough to make ends meet, or just trying to make things happen in whatever ways they can, and they're not really able to access opportunity. And so that just has to, we feel like we can't wait for the federal government to change in this space. So we're excited that some of the recovery funds that are available to the district, that we can program these funds this way to try to demonstrate what happens when people have real access to opportunity. It's something that we've been focused on and for a long time. We're excited to partner with potentially with Federal Reserve and have an individualized asset income calculator where people can look at whether they're in this pilot or not, at what point do they lose eligibility for benefits, so that they know what they can afford to do or not do as they plan their own destiny. But what I think we need to listen to folks in our programs. Their voices need to be at the center. They are the experts in what they need, and we know what it is they want. And we do need to stop treating people like they must show us a timesheet in order to be deserving of the income supports they need to care for their families.
I mean, Laura, it sounds a little like you're going through perhaps the same process George and I went through at the beginning of Thrive, where you really have to think hard about advising families, even when you say what they can and can't do, even with the resources that you want to make flexible for them.
Right. And I think we'll learn a lot in doing this, but our goal is to empower families, reduce scarcity, remove the earning penalties that families face as they begin to grow their income, and provide the coaching and supports to navigate what are really challenging programs to navigate in order to pursue stackable credentialing and degrees to access meaningful careers. And we'll work with a lot of really smart economists and others on the back end to model what we need to do on the budget side, so that we can ensure that at the end of the day, families have access to the resources that they need, so they're able to pay, they've got enough money on their EBT card and enough cash in order to be able to pursue their goals.
I think one of the things that I've seen over the course of my career is that we boil people down in our public systems to the funding stream they're attached to. You are a food stamp recipient. You are a TANF recipient. This is not true. You don't work. You get public assistance. You must not work. You do work off the books or what have you. No, people are whole. One of the things about the sub-minimum wage workers, Shamila verify this for me, is that often you see people who are on tipped wages and reliant on public assistance. Is this true?
Yeah, this is true. Do you want me to share some figures from
Sure.
DC specifically?
Yes, please.
Okay, great. So as I mentioned, prior to the pandemic, 6 million service workers lost their jobs. Here in the district, over 60,000 DC restaurant workers and over 27,000 tip service workers have been disproportionately likely to live in poverty and rely on public assistance. I described the categories before, but just to remind you, these are restaurant workers, nail salon, car wash, airport workers, parking attendants, as you mentioned, tipped gig workers, and others. They are... sorry, just give me 1 second to find my notes. As a result of low wages and the instability of tips, as I discussed, tipped workers in the district are over 3 times as likely to live in poverty and more than twice as likely to rely on Medicaid compared to the rest of the workforce in the rest of the country. And nearly 9% of tipped workers specifically live off food stamps, which is twice the rate of other workers. On top of low wages, restaurant workers report, sadly, some of the lowest access to paid sick days out of any industry. And you can imagine how this would be a ginormous problem during a global pandemic, to not be able to access sick days, not be able to feel comfortable in reporting to your employer that you've experienced symptoms, for example, for loss of income and all the other kind of repercussions that one might face. That really, I worked, as you mentioned, I worked in the service sector for 10 years in this blue state of Massachusetts, where, we do have paid sick leave and paid sick time and all these things. I never knew that I could access it, right? It's this inability to really trust the information. I think, your employer says one thing, but you're like, those rules don't count for the restaurant industry, right? It's like one of these things that it's always been considered the wild, wild west almost, where there are so little protection. There are so many independent operators that it creates a huge burden for enforcement. Under the Obama administration, the Department of Labor did a compliance sweep to find how many employers were actually making up one problem that we face is employers not making up the difference between the sub-minimum wage and the overall minimum wage, as is required by law by pay period. And they did a compliance sweep and found that over 84% of restaurants were not making up that difference. And at the end of the investigation, the solicitor was supposed to issue a statement of recommendation, and they found the issue essentially non-enforceable. And so when you don't pay a person a full fair wage, then there's this after effect into the other aspects of their paycheck, their benefits, their sick time that they can't access or accrue as a result of their wages being unreported.
Yeah. So we heard in the previous two panels, one of which my colleague Elaine Mogg, who's here today, talked about the child tax credit, which is sort of the big news of the week, cutting child poverty in half. With a subsidy, some people call it UBI for children, that will help folks have a little more money in their pockets. And we know from EITC research, what do they do with that money? They spend it on their children. So we're seeing some flexibility in the system through that program. And the nice thing about that, and I repeat this all the time because I think it's just a miracle, is that when you do, even though the tax system is such a blunt instrument for helping people, when you give people money through the tax system, you actually avoid some of these cliffs we're talking about, is that the money is not counted towards their annual income. So it's a big reason that that's a healthy strategy while we figure this all out and get away from these cliff effects. George, I'm going to ask you to take us out on the panel by talking about, you deal with some of the most marginalized, lowest income people in your programs in the city. I think your organization has steered towards a very interesting racial equity agenda that has a lot to do with cash transfer in it. Tell us about the dignity and the choice that cash brings, and how you think it could be transformative for the folks in your population who work and don't work.
Well, to us at Breathless City, dignity and respect is everything. So you could have asked me any question, and I would say at the center for us is making sure that we relate to and center our community members in a way that is undergirded with dignity and respect. And so certainly when we decided to stand up the Thrive Initiative and to the large extent the Excluded Workers Fund, one of the fundamental sort of values is this idea that people can spend these dollars on whatever they choose. Like there was a little bit of temptation from some of the partners to start talking about what people could use them for, how to track what people were spending on. And it's not that we're not tracking that because we want to know for posterity's sake what people are spending. But the truth of the matter is it's really important for folks to be able to spend these dollars. And so that was all about dignity. And it was all about trusting our community members. Laura talked about it quite eloquently, that like these are grown-ups. These people know what to do. And all of the mythology about people trying to exploit the system. This is not a system to be exploited. This system is exploitative. It is not designed to be exploited because it's winning when it comes to exploitation. And so that's what I'd say. But I scribbled down a few words here because you talked about our racial equity. Brett has been trying to advance this work through a racial equity lens. And so there were a few words that popped up to me that I just wanted to throw out, and maybe people will ask questions about them. But one of them, the first one, was systemic racism. A lot of my white friends in particular struggle with this whole concept of what systemic racism. Certainly my board of directors had a problem with it, but Laura was describing it, Yamila described it. When you set up systems that hurt Black people and brown people disproportionately, you are talking about a systemically racist system. Doesn't matter who's running it, whether George Jones is running that system or Mary Bogle, whoever's running it, you're running a systemically racist system. And for the most part, it is probably because, as Yamila said, it's because most systems were designed in this country in the early 1800s, 400 years ago, to be systemically racist. Slavery, Jim Crow, et cetera, redlining. And now we get to our programs, and those of us who think we're enlightened think, our programs are all sort of cleansed of that. No, they're almost all modeled after some version of that. So that's important, right? Trying to get people to understand that that's what systemic racism is. It doesn't matter what you care, how you think about, whether you like Black people or not, or brown people or not, or white people for that matter. It's what the system does that matters to those of us trying to undo those systemically racism. Yeah. The other thing is targeted universalism. My favorite terms that I heard from John Powell out in California. And John talks about targeted universalism being about you target a particular group if you really want to sort of deal with, for instance, poverty. But there's universal benefit to all of us. And one of my little sort of funny cliches about it is that somebody was complaining about homeless people sleeping on the Wilson building step. having to step across them. Well, if we fix the homelessness problem in here, you won't have to step across homeless people either. So you get your benefit and homeless people get some place to live, right? And so, but that's sort of just a small and not really the point about targeted universalism. Targeted universalism is really about if we do what Laura was talking about, which is get away these cliffs, make it people able to go from stability to social economic mobility. We'll all benefit from that. That we won't have to, our taxes will improve. The quality of life in our cities will improve because when everybody's doing better, we all do better, right? Thank you.
Great, thanks, George. Now, I do want to take a few questions, but I felt that was a great way for us to sort of leave you with the sort of panel speak. So Hala, how is this going to work again? Should I take from the audience, or are there any of the online participants? Okay. Yeah, I warned you there would be awkward dance moves today, so.
This is actually just a clarification around, you mentioned that, especially with Medicaid, there's income cutoffs that mean that basically once you have some level of savings, you lose your benefit. But the question was, doesn't Medicaid allow for exceptions for short-term payments? I think SNAP and TANF could both allow for disregard when cash assistance is a one-time short-term payment. Or what is the state of, the policy push that you've talked about to indemnify the people who are receiving the cash transfers that all of you have talked about with the programs that you've run?
Well, Laura probably knows the technical answer to that better than I do. But we weren't willing to, the dilemma for us is that we couldn't play with people's benefits. And so whether or not they were going to report them, they needed to report them, what the impact would be, we just knew that there was potential for someone to lose benefits that they just couldn't afford to lose. And in fact, one of the anecdotes we tell is that we had families literally that turned down $5,500 because they were so worried. As Laura said, they're barely able to survive on these programs. If they were to lose one, particularly one essential as Medicaid, it could be catastrophic for their families.
Laura, do you want to talk about how you might be working across agencies on career map and thinking about, because it's, again, people are a totality of health and transportation and things that they need in their lives. So how are you thinking about it?
So we want to create something that is going to be overall sustainable in the long run, which is, I think the easier thing for us to do would likely be to do a one-time payment that could make up a difference, but it's not something that we think could change the entire system. So what we'll do is we will model eligibility and we will substitute in as people would lose or their eligibility for various income supports would be reduced. We will augment that in so that they're able to make up the difference so they don't see a net loss. And also, we know as people work more, their costs actually go up. Their transportation goes up. They might need clothing or other equipment, and that people need to be able to also see an increase in their household income. So we will protect their ability to see an increase, and we will augment that on the back end. And we don't know yet. I can't tell you how each of those programs are going to interact with the sort of the augmented benefit that we provide, but we're committed to people being able to continue to see increased assets in their household in the long run. And our hypothesis is that in the end, that as they are earning and paying income tax, that we will see that return on our investment, both in terms of people not cycling back into income support programs, but also because their children will thrive. And there's all kinds of data. We know that increasing the economic well-being in a household has very lasting and proven effects on what children are able to do in their lives. And so it's not only the right thing to do, but it's fiscally, we think, the responsible and smart thing to do.
Yeah.
We have one quick follow-up from online. Laura, would you be able to describe the MAP program in a bit more detail? what sort of Washingtonians will be eligible, how much money is allocated per month. I think you said it was a lump sum.
So it's we're still doing the program design. So right now it's a proposal in our budget that we would that is funded to support 300 families over the course of 5 years. We'll work with a subset of families in our rapid rehousing program. So these were families who had experienced homelessness, had been in shelter, and have exited shelter with rent subsidies that are not vouchers, that are not long-term subsidies. We already see that we, in some ways, are, for these families, the district is subsidizing their entire rent. We are providing more than 75% of the time a TANF sub benefit, as well as SNAP, Medicaid, childcare subsidies. So what we'll do is we will work with families in this program. We don't yet know how we will do the selection, but we'll figure out a way to do it that is fair and that people can, who are interested in pursuing a career, and we will support them with case management and career coaching as to identify career goals, support them through that and through their plan in that entire process, and without fear of losing an essential benefit along the way. Lots of work to do on the design and on the making sure that we have the right data to capture what we're learning, and we'll have many partners with us at the table as we do so.
I think as a researcher, I want to say that there's the number of cash pilots going on in the country right now is something like quadrupled. I mean, more than that even. Some of the more famous ones are the one going on in Stockton, California, Magnolia Mothers Trust in Mississippi. And one of the benefits of these, they're very small cash pilots, but one of the benefits is what we will learn. So I think we should all keep an eye on Career Map, because the point of today is to communicate that it's federal cash relief that can make the biggest difference. It's the federal level where the real money is, frankly. And rather than see this as some kind of, income distribution program that benefits people who aren't going to use the money properly, let's see it as a way to get people out of poverty. Let's see safety net reform as a way to really support people and believe that the choices they make with cash are good for themselves and their families. As Laura has alluded to, the data on this is overwhelming. The effectiveness of giving people money is very high. It's much more significant than most other interventions you can run. And when you give people money, the data also shows us that they use it on things like advancing their children's education. So what's not to love? Any more questions, Hala? Not any from the room here today, as we're trying to
imagine that people are better off with more money.
Oh, wow. That I can't imagine, George. You're blowing my mind here. Any other questions today, or shall we move on to the folks in the room are having lunch, but we will say goodbye to the folks on Zoom. Thank you for being today. And again, thank you for your patience with the little glitches and awkward dance moves you saw, but we're all getting used to this recovery thing together. Thank you. Bye-bye.
Thank you, everyone. I'm Mary and our incredible speakers. That concludes our last panel for today. Please join us in a delicious lunch if you can, and continue the discussion among ourselves. And then a recording of this third session will be available on our JFI's YouTube channel. Once again, I'll say JFI is a nonpartisan applied research institute with a core focus in guaranteed income and broader safety net policies. So reach out to us if you'd like to. Again, and contact information is in your folders, as well as some additional readings from all of your speakers. So thank you so much, everyone.